Sciatica versus sacroiliac joint pain. Are you tired of living with excruciating leg pain that limits your mobility and daily activities? In this video, I'll show you how to differentiate between leg pain that is associated with sciatica and leg pain that refers from the sacroiliac joint. In addition, I'll introduce you to a unique non-surgical treatment that can bring you fast relief. If you're experiencing severe leg pain, it's always crucial to know what the underlying cause is. In this case, it stems from sciatica or a sacroiliac joint issue. Now, both conditions can cause intense leg pain and discomfort, but they require different approaches. In this video, you'll gain the knowledge to distinguish between these two common sources of pain and learn about effective targeted treatments. With 30 plus years of experience helping thousands of patients overcome leg pain, we developed a comprehensive examination and treatment protocol. My non-surgical treatment method is backed by a high success rate, providing safe and reliable results. By watching this video, you'll not only learn about the anatomy behind sciatica and sacroiliac joint dysfunction, but also discover that leg pain often has multiple causes. I'll show you how to address these causes with a comprehensive approach that brings fast relief. And please stay to the end of the video where I'll reveal a revolutionary non-surgical treatment method that targets various causes of leg pain and has helped many regain their mobility and live pain-free. Hi, I'm Dr. John Zawanka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for over 30 years now. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs or surgery. I upload a new video every week. In addition to that, I've created a free Health Vault. It's a collection of exclusive videos that get delivered to you each week with trusted health knowledge and lifestyle hacks. You can get it at the link in the pinned comment below. Before I explain the difference between leg pain from sciatica and leg pain originating from the sacroiliac joint, there's a crucial concept you need to grasp. Often leg pain isn't caused by just one issue. It typically stems from multiple factors. Understanding this can be the key to getting the right diagnosis, receiving the correct treatment, and achieving lasting relief. A thorough consultation and comprehensive examination, they're essential to uncover all of the underlying causes of your pain and suffering. When diagnosing leg pain, it's essential to rule out the following potential causes. Number one is what we call a disc bulge or disc herniation. So if we look at them all of the vertebrae here, you've got the vertebrae, you've got what should be a nice thick disc, you've got another vertebrae on the side. Out of these openings, these yellow things are the nerves, and they're coming right off the spinal cord. That goes up to the brain, and that's how your brain controls everything that's going on in the body. What's happening in the disc bulge is you can see that the disc itself is actually now starting to bulge out. And when it bulges out like that, or herniates, or prolapses, it starts to put pressure on that nerve. Number two that we have to look for is what's called radiculopathy. So this is what most people think of as a pinched nerve. The nerve pain originating from the lumbar spine, it can be caused by degenerative arthritis, and it can also radiate down the leg, causing that leg pain as well. Number three is what we call neuroforaminal stenosis. So again, let's get back to this vertebra here. And so the neuroforamen is that opening where the nerve comes out. Stenosis means narrowing. So if that space narrows, again, it's going to put pressure or compression on that nerve. So think of that where those spinal nerves exit. Typically can be due to a disc bulge or degenerative arthritis, can also cause leg pain. Number four is what we call spondylolisthesis. So spondylolisthesis can be broken down into anteriorlisthesis and also retrolisthesis. So anterior just means forward, retro just means backwards. It's just simply referring to which way the vertebrae move. But in spondylolisthesis, the vertebrae one vertebrae shifts on top of another one. And when that shifts like that, again, it's going to tense that nerve. That can also cause leg pain. Number five is lumbar stenosis itself. So now it's not just that opening where the nerve exits that narrows, but now we're getting a narrowing inside the spinal canal itself, where now you're putting pressure on that spinal cord itself. Number six, we've talked about this before, can be sciatic nerve compression at the piriformis muscle. So remember, the piriformis muscle is basically in the back of the butt, and it's what we call a lateral rotator of the hip. And in about 80% of the population, that nerve goes right underneath the piriformis. If that piriformis is contracted or in spasm, it's going to compress the nerve. In the other 20%, that nerve goes right through the piriformis muscle. So again, if it is contracted or in the spasm, it can't help but also put pressure on that nerve. And then number 7 is the sacroiliac joint. So the sacroiliac joint, again, people get this confused all the time. The sacroiliac joint itself, right, is if we look at a model of the spine, and when you were a kid and the teacher told you put your hands on your hips, well, we weren't really putting our hands on our hips. We were putting our hands on top of the pelvis here, and the hip itself is actually where the femur meets, into the pelvis here, and that's when people get their hip replacements. That's what's being fixed. So this, the pelvis itself, is also referred to as the ilium, and if we look in the back, the bottom part, just below the lumbar spine, then comes the sacrum and then the coccyx. And so the sacroiliac joint is where the sacrum meets the ilium. So that's why it's the sacroiliac joint. Most doctors who specialize in this don't like to say sacroiliac all the time, so we simply call it an SI joint. And again, if there's pressure on the nerve in that area, that can also mimic leg pain as well. That brings us to the key difference between sciatica leg pain and leg pain from that SI joint, or that sacroiliac joint dysfunction. And it lies in the origins of where the nerve is actually being compressed, and hence the nature of the pain. So in sciatica leg pain, what we're getting is sciatica is going to be caused by irritation or compression of the sciatic nerve. So remember, the sciatic nerve is formed by a group of different nerve roots that then come down the back of the leg, typically resulting from issues, obviously, then in the lumbar spine. Could be that herniated disc, could be spinal stenosis, could be degenerative disc disease, and so forth. The pain pathway is going to be such that it usually radiates from the lower back down through the buttock. It's going to continue into the back of the thigh, sometimes extending into the lower leg as well, and all the way down to the foot. In a lot of cases, it's going to follow the path of the sciatic nerve. The pain characteristics are going to be such that sciatica pain is often sharp, shooting, burning in nature. It may be accompanied by numbness, tingling, or weakness in the affected leg. Sacroiliac joint dysfunction and the leg pain that stems from that, on the other hand, is obviously coming from that SI joint. It's going to arise from the problems in the sacroiliac joint where the spine meets the pelvis. This can be due to inflammation, misalignment, abnormal movement in that joint. Often when that happens, it can also cause a leg length discrepancy, and this confuses a lot of people because they don't understand, and a lot of doctors don't understand the difference between what we call a true leg length discrepancy and a functional leg length discrepancy. Very few people have a true leg length discrepancy. A lot of people have a functional leg length discrepancy that then tips that pelvis, and that's going to put more pressure on that SI joint, and not to mention changes the function of the lumbar spine above it as well. The pain pathway, when you've got the SI joint problem, is going to typically originate again in the lower back or the buttock. It may radiate down the back or side of the thigh. However, rarely does it go below the knee. It's usually going to stay above the knee. The pain characteristics are going to be such that it's usually a dull, aching pain, but it can be sharp. It may worsen with activities. You may find getting up slowly from a seated position is going to be tough because all that puts stress on the joint. So sitting, standing, walking, or climbing stairs. Understanding these differences can help us in diagnosing the root cause of the leg pain and then determining the appropriate treatment. The best treatment approach for leg pain, especially when dealing with complex conditions like sciatica or sacroiliac joint dysfunction, is what we call a multimodal approach. So this means addressing the pain from multiple angles, combining different therapies and techniques to target all of the underlying causes and provide comprehensive relief. Last, what we need to understand is it's very possible that you may have an SI problem and sciatica at the same time. So again, that's where the examination and consultation becomes so important. What we do in here as a neurofunctional chiropractor, I like to be very specific in what we do. We do something called spinal neurological correction. So this is not just your typical adjustment. I'm looking not just to restore spinal alignment, but to restore function, to restore normal nerve function, to restore normal movement as well. We also practice something called ART. So ART stands for active release techniques. That's great that you're getting correction of the spine and restoring nervous system function. Often over time, people have developed adhesions and scar tissue in the musculature as well. So it's something by restoring that, we also get better function that way. I'm what we call a certified rehabilitation doctor, so all of our patients also go through something called neuromuscular reeducation. What happens is the body compensates over time, getting used to what you've been living with. That's not a good thing. Basically, the brain has stopped sending the proper messages to various muscles, and the body has literally stopped working the way it should. So this isn't just going out and giving you the top 3 core exercises. This is specific to you, to restoring the brain so that the nervous system can work the way it should be, so that the muscles can work the way they should be. And this is all done through neuromuscular reeducation and very specific functional rehabilitation exercises that are specific to you. We certainly get into ergonomics and postural considerations as well, is we live in a real world. So if you are spending 10, 12, 14 hours a day sitting in front of that desk or computer and no one's teaching you how to improve that, you're just going to keep bringing the same problems back on as well. We very much get into nutraceuticals. Instead of giving you the painkiller or the anti-inflammatory that A, never fixes the underlying cause of the problem, and B, is going to have long-term side effects for sure, why not give your body the nutrients that it actually needs to heal and to repair and to do all this naturally, but based on the science? And then last but not least, none of our patients are ever cross our fingers and hope. All the testing that we originally do in your initial exam are also used as a baseline so that we can measure your progression from a functional and objective point of view. We never want someone to be opinion. Let's see what the test results actually show. The cornerstone of my multimodal approach is what we call non-surgical robotic laser spinal decompression. It's a unique and cutting-edge approach that combines 2 research-backed treatments, spinal decompression and class 4 laser therapy. This advanced technology is specifically designed to address disc herniations, disc bulges, and nerve compression effectively. What sets this method apart is exclusivity and precision. There are only 12 systems available worldwide, and we're proud to have the only one in Ottawa, Ontario, Canada. This makes our clinic a leader in providing this groundbreaking treatment. Non-surgical robotic laser spinal decompression is highly effective in treating a variety of causes of leg pain and back pain. It works by gently decompressing the spine, creating space for discs to heal, and relieving pressure on those compressed discs. The class 4 laser enhances this process by stimulating tissue repair, repairing muscle, reducing inflammation, as well as allowing for better spinal decompression, as both forms of care happen simultaneously. The combination of these therapies not only addresses the root cause of the pain and dysfunction, but also accelerates recovery, often treating multiple causes simultaneously. For leg pain and sciatica, this method has proven to be exceptionally successful. We've provided thousands of treatments to help people find relief from pain and return to their normal lives without the need for invasive surgery. When it comes to sacroiliac joint pain, we enhance our advanced treatment approach with very specific neurofunctional chiropractic adjustments targeted at the SI joint. These adjustments are essential because they correct the biomechanics of the joint, restoring its normal function, normal alignment, and normal nerve function. The SI joint plays a crucial role in connecting the spine to the pelvis, and when it's misaligned or dysfunctional, it can cause significant pain and discomfort, not only locally, but also radiating down the leg. It also often leads to a functional difference, as we mentioned before, in leg lengths that can be corrected with proper care. Chiropractic adjustments help to realign the SI joint, ensuring that it moves properly and functions as it should. By restoring proper biomechanics, these adjustments reduce the strain on the ligaments and tissues surrounding the SI joint. This in turn decreases inflammation, it alleviates the irritation that contributes to the pain. As the inflammation subsides, patients will often experience a significant reduction in both pain at the sacroiliac joint and the leg. It's this combined approach, the non-surgical robotic laser spinal decompression for the comprehensive spinal issues, and the targeted neurofunctional chiropractic adjustments for SI joint dysfunction, that provides a holistic solution that addresses all the aspects of your pain. It ensures that both the root causes and the symptoms are treated effectively, leading to lasting relief and improved overall function. You've just learned about the critical differences between sciatica and SI joint pain, or sacroiliac joint pain. and how understanding these distinctions is key to finding the right treatment for you. We've explored how a multimodal approach combining advanced non-surgical robotic laser spinal decompression with targeted neurofunctional chiropractic adjustments can effectively address the complex causes of leg and back pain. With this knowledge, you're now better equipped to make informed decisions about your health and treatment options, whether you're dealing with sciatica, sacroiliac joint dysfunction, or both. You know that a comprehensive and precise approach can lead to lasting relief and a return to normal life. We see these cases all the time. Now it's your turn. Tell us your story about leg pain or low back pain. How has it impacted your daily life? Have you found any treatments that have provided relief, or are you still searching for the right solution? We'd love to hear about your experiences, what's worked, what hasn't, and any advice you might have for others going through the same struggles. Share your journey with us in the comments below. If you found this video helpful, please give it a like and share it with others who might benefit. Be sure to subscribe for more insights and strategies on relieving back and neck pain naturally without the need for drugs or surgery. There are a lot of people living with things they don't need to live with. Let's help them together. Next, check out our video that outlines a professional step-by-step treatment protocol for conditions like sciatica, disc bulges, and lumbar stenosis. It's designed to show you how our advanced methods can provide effective relief. Don't miss it. Watch now to learn more.